At this doctor's office, which specializes in hair replacement therapy, hygiene is a top priority. That's why they go through hundreds of medical examination gloves a day. But recently, a technician noticed something unusual about the latex gloves.
Seeing we have lots of microscopes that we use during the course of our work, she put the glove under the microscope and discovered that those irregularities were actually insects. Manufactured, it appears, into the surface of the glove.
The gloves are found in medical and dental offices across the country. They're used for all internal exams like pap smears or prostate exams, as well as oral exams. The box doesn't say where the gloves are made, but lists the importer as Hedy Canada, based in Calgary. Dr. Hassan called them, demanding an explanation.
The lady that I spoke to speculated that the bugs may have been attracted to the fluorescent lights in the glove factory where the gloves are produced.
In China?
In China. Not the kind of explanation we really wanted to hear.
Just to be sure, we took the gloves to a private lab in Richmond.
So these are the gloves. Okay.
The lab tested 9 gloves, and this is what it found. 3 insect bodies identified as flies embedded in the gloves. Several insect particles, some embedded, others melted to the gloves. Particles consistent with insect larvae, small, unidentified black particles, and perhaps most problematic, all of the gloves had holes in them where the particles were embedded.
People may just think that they're specks of latex or whatever in the glove, and unless you actually have the microscopes, you wouldn't be able to find out what it was.
So a lot of doctors' offices, dental offices probably have no idea that these things are in their gloves.
That could be the case.
Hassan shipped back 14 boxes to the importer, Hedy. We called the company today to get a response.
You talk to any of the suppliers, they will confirm that not only are there occasionally inclusions, what the Health Canada would refer to as an inclusion in the glove. It happens on occasion, not frequently.
So you didn't find any bugs whatsoever in the gloves that you inspected?
No, that's correct.
Okay. And did you have them under microscopes?
No, I would not expect so, because normally it's what's described as a visible inclusion.
The company, which is one of Canada's largest suppliers of medical gloves, distributing about 1 million per week, says the gloves are made in Malaysia, not China, and say they've been dealing with the factory in question for 10 years.
I mean, it's obvious of great concern, because we take great pride in producing consistently a very good product, and have done so for many years, and therefore anytime we have any sort of problem, we take a great pride in terms of following up with the customer and making sure it's been dealt with, and any implications for the manufacturer.
It's certainly nothing that anyone would like to see in a medical product.
And it kind of raises questions about what else is going on that people aren't catching.
Absolutely. This may just be the tip of the iceberg. Who knows?